The Tennessee Department of Health logo transitions on screen into a text slide. On the Line, a training series for telehealth and behavioral health. A series of free 1-hour training sessions for licensed and pre-licensed behavioral health practitioners in Tennessee. Training offers an opportunity to learn best practices for providing telemental health services. Each training session is held online and qualifies for continuing education clock hours. Next on screen is a man being interviewed.
For those that are new in the field and learning to implement telehealth, this training is very important because it offers, among various populations, different protocols you can work with. It increases your comfortability when working with people through a telehealth modality. It helps with expanding services, so if you're not comfortable, you're not going to provide that service to the client, right? And in the long run, that might be the thing that harms their care. So it really helps to center and refocus their care as the thing that we're trying to offer to them and to help them work through. My name is Tyler Sanders. I work for Centerstone, and I'm the clinic manager at the Columbia location.
Telehealth information on the Centerstone website.
I participated in the telehealth best practices training because I didn't feel comfortable with providing telehealth services, so I wanted extra training. And as someone who does work predominantly with people who experience suicidal ideation, having something to reference and a protocol to lean on when I'm working with a client was very important to me.
A screen showing the registration process on the Tennessee Department of Health website.
Signing up for these trainings was really easy. The Department of Health sent their community partners different ways to sign up, and then that was sent out to staff at different agencies. I was able just to get an email, sign into the link, and then I got the Zoom invite for when the training occurred. So I think the Tennessee Department of Health was instrumental in implementing this training, not only with my agency, but agencies across the state.
A female telehealth agent delivering services on the computer.
I get excited thinking about the different populations that we can tailor the trainings to, being able to help people, but also empower people, meet people where they're at, and kind of see them in the whole environment, the whole person in the whole environment. And as a provider, I think if you can be flexible, that's a good thing to do.
Computer screen of a female telehealth agent delivering services.
So the fact that the Tennessee Department of Health offered this training, I'm very appreciative of, because it allowed me to expand my knowledge base in the way that I practice with my clients. And I would say that if you're skeptical, just take it. Then you can make a decision. Maybe you already are comfortable with working through telehealth. This gives you more language and more skills to be able to continue practicing and building on what you already have.
2 people in a telehealth session on a tablet.
The trainings helped us work with people who are experiencing suicidal ideation or behaviors in 2 really good ways. One, it enhanced how often and the frequency we could see them, so they were getting more care to treat the suicidality more frequently, but also the safety aspect of having the safety plan addressed at the beginning of each session, finding the location of the client. That way, if they did need help or maybe they weren't feeling safe, we would be able to get them the help that they need as soon as possible. So these trainings directly result in the betterment of our clients and the way in which they navigate their life.
The Tennessee Department of Health logo transitions to text on screen. For more information, go to www.preventsuicidetn.com. Sponsored by the Tennessee Department of Health, with funding provided by the Centers for Disease Control and Prevention.